The worst cholera outbreak in recent history, about the last 2 decades, has claimed over 1,000 lives in Malawi, and it continues to spread despite government's efforts. The global impact of the disease is staggering, affecting 31 countries, according to the World Health Organization. Unfortunately, vaccines for the disease are still in short supply, leaving countless individuals at risk. This cholera epidemic is a personal and heartbreaking tragedy for so many families and communities. Each life lost was a unique individual with your own hopes and dreams, leaving behind loved ones who will never be the same. The fear and uncertainty surrounding the disease only adds to the heartbreak and sorrow. As the number of cases and deaths continue to rise, the situation becomes more and more dire in Malawi. Question now is, what can be done to help prevent further loss of lives and bring an end to the devastating epidemic? That's why we're on the square today. My name is Keminni Amanor, and you're welcome. Joining our gathering are Maziko Hisbon Matemba. He's a health activist and executive director of the Health and Rise Education Program in Blantyre-Malawi. We also have Henry Mhango. He's a journalist in Lilongwe, also in Malawi. Gentlemen, you're welcome to the square. I'll start with you, Maziko, because only about 4 weeks ago we had this conversation. Did you see this coming?
Yes, I saw it coming. Thank you so much, Keminni, that we need to reassure the global world that we still have this challenge amidst us. Only yesterday, I had an opportunity of visiting some villages just to appreciate what's going on. And what I'm getting out of the discussion I had with the chiefs in the villages, just to find out what's going on, it's clear that indeed the cholera has indeed gone into the system, and it requires that we need to do something. I'm saying this because currently availability of chlorine in most, chlorine also helps in killing the cholera. But also we had also challenges in terms of availability of water guard. Water guard, this is a liquid which normally helps in making sure that the water which people are drinking. The challenge which I think we have had now is a challenge which has been there for some time. Because as you all know that when people are trying to build their latrines, but also their toilets, we have these toilets which people do. We found out that most of those places are not well taken care of by the public, but also they don't get much advice from those who are supposed to control in terms of access to water, because most of the people use boreholes. So when the water table has gone up with prolonged rains which you are receiving at the moment, there might be some contamination. So if you have one person which have the condition, for example, and he has used one of the sanitation facilities, in our case toilets. These are toilets which are built by members. It means that if the water comes up and it spreads within the soils, automatically you can find out that it can contaminate the water source. Because most of the community members, they don't have piped water. Most of them, they use these boreholes, as I mentioned.
Right.
The only solution which you have at the moment is to do more research. Because
and I want us to look at that a little later, Maziko. Maziko, can you hear me? I want us to look more about at the research
yes, I can hear you.
bit in a moment. But these were the same problems that we enumerated, and the leader of the task force on our last conversation had said that officials in Malawi were doing something about some of these problems. And so I want to come back to Henry here, who's a journalist. Henry, what has the government been saying about why they think that their measures are not as effective as thought?
Okay, thank you so much. So to a large extent, the government has been putting a blame on failing to, I should say, on behavior change, where people are failing to change their behavior. People are still living their life as usual. They are still doing their business as usual. For instance, you find that if you go to local markets, you still find people selling fresh food stuff, and people are buying and consuming the food stuff without even washing it. So it appears on part of the public, there is less which is being done for them to prevent the disease. The government claims to be doing enough to prevent the spread of the disease. But as a journalist who has been able to move around and going even in difficult to reach places, I can see that I think there is still more to be done in order to prevent this disease. For instance, you find that on the part of government, they haven't enforced the preventive measures as they did with coronavirus. During the coronavirus, the government had set up a number of preventive measures. For instance, mandatory face mask wearing. Everyone who could not put up the face mask, government was taking an action against those people. We could see police officers patrolling the cities and take action against those who are not following the preventive measures. I thought the government would do the same, especially this time when the situation is really there. But this is not happening. People are still living their normal life. As I'm saying, like when you go to villages, you find that there are some people are still consuming water from, I should say, untreated water, unprotected water, and well water from.
Well, can you blame them, Henry? Can you blame them? There are no other sources for them, or if those sources are dry, if best case scenario, and so then that's what they are left with. We'll look at other ways to deal with that, but. You were talking about measures that you thought the government would put in place. Some of the measures it did during the era of Ebola. On the contrary, it has revised its measures, and one of those is making sure that some businesses, particularly those who sell pre-cooked food, are closed down. Talk to us about how that is working out so far.
Yeah, so, I can't say that this is really working because, like when I move around the market, you find that people are still selling fresh food. The ban, of course, the government issues the ban, but you find that ban only materializes for maybe for a few days. For instance, there is a closed by the government just some weeks ago. But you can imagine the government closed the market around 10 a.m. By 3 p.m., people were busy selling their commodities there. And yet, this is the market that has no toilet. So you can see that government, of course, claims to be doing a lot of this. But when you go on the ground, you find that there is nothing happening. A very good example is the market. And I think this is one of the areas that government would have put much effort, because this is the place where people from different places are coming to meet. This should be one of the areas that maybe influences the cholera outbreak in Malawi. So I would still love that. Yes.
Very well. I want to go to Maziko now. I'll come back to you in a moment, Henry. But Maziko, let's look at these renewed efforts by government, the banning of some businesses, the closure of marketplaces and people who sell pre-cooked foods. What do you think about this? Was it the best decision to have taken, particularly in the times that we live in?
Yes, I know that most people would be more inclined to say that we need to do the banning of this and that. But if there's like awareness, because I don't think that people don't know that cholera is a dangerous disease. People do know. But the challenge now is how do we come back in terms of making sure that we remind them that in our midst we have this challenge. the cholera outbreak. There's some mismatch if you look at the behavior, how people are behaving, and also looking at the cholera. When, as I said, I visited some health centers, it was shocking to see that the cholera seems to be so fatal in our health facilities. In fact, one of the facilities I visited, I saw 2 people dying whilst I was there. And when I asked the authorities, they said they have died out of the cholera. So I was asking myself, what are we doing to make sure that we avert some of these deaths? They said, community members already that are coming to the facility already they're sick, or they don't have no alternative, because a delay in going to facilities is also another major challenge, which is also affecting the people who have got that. But also, that's why some of us, and we said we're going to discuss later, issues of research to determine of how is this spread, and also just to find out more on how we can curtail the host. Where is it spreading from? Is it spreading more from the contaminated water, or is it spreading more from contaminated food? Or is it spread over through the flies, you know? So it has to be established, because if we don't establish where it is coming from, is it contaminated water? If it's contaminated water, how do you manage and making sure that the water which is being contaminated is being treated, and people are not getting untreated water? So
Maziko, isn't the
which I think as a country remote.
Isn't the government's data providing that information?
Yes, the data is coming, but if you look at the data which we are receiving on the daily basis, which is shared through the task force on cholera and COVID, you find out that that data is showing, more especially on the treatment side, on how many people have been affected, because you can easily collect that data from our treatment sites, from our hospitals, which is very easy to get. But there's another data which you see on the side of the behavior of the public, how people are treated their water. They are treating their water well, or they have lost interest in treating the water. What about the actual behavior in terms of making sure that the sanitation facilities is taken care of? The food which they are taking, or how are they treating it? Are they still doing the same things as Henry has said? So all those things have to be identified. But also, what is key, which is also which is saddening, is it is coming at a time when the government fiscal space is challenged in terms of resources. So if we don't receive any support, for example, right now we have run out of the cholera vaccines. It shows that the government is handicapped. If it doesn't have enough resources to procure on their own, what's going to happen? It means we might wait a little longer, more especially for the communities which have no control. Because as you also we are aware that cholera in our setup, it's more about poverty. Because we have just observed that most people who are dying with the disease, they're not people from the urban areas. Most of them from the rural, poverty-stricken communities. That's where most people are dying out of the disease.
Very well. So you said a few many things.
To get.
You said a lot of things over the last few minutes. I want to take some of them to Henry over there. Henry, now you have been talking to people every day as part of your work. Tell us what you think their perception about the disease is.
Okay, so I would say that maybe the main challenge is that people are not being fed. Are not being fully fed with information on the spread of the spread of the virus. So the fact that for instance, maybe I'll say that today you go on the market and you buy pre-cooked food, then you find that you're not contract the disease, then you feel like it's okay. And now when even the message is coming to you about the causes of cholera, people normally don't take it seriously until they are hit by the problem. I feel that's one of the challenges that we have. Yeah, we wait to be hit first by the problem for us to take action, and this is what is I'm sure this is what is also contributing to this rate. Because what I'm saying here, government has tried to ban the selling of pre-cooked food, but the same food is being found on the market. People are still buying it. I was trying to ask myself one day when I saw my neighbor buying some of the cooked food. This is someone who has been watching TV, has been listening to radio now and again, but he was busy buying pre-cooked food for the children. And I was trying to ask myself that, okay, fine, does he need government to tell him that you shouldn't do this to prevent your children from contracting polio? I mean, it's something that was set in my head. If I contract it, it's me who is going to die. And I feel like it's something that has to start with me. And that's I think the thing that maybe the media and the government at large need to instill in the people. We need to instill that ownership. In that way, I feel like people will be able to take the preventive measures seriously and be able to prevent themselves from the behavior that influences the spread of cholera in Malawi.
I see. Now, talk to us about what reasons government has given as to its inability to secure more vaccines for people of Malawi.
So the government, of course, has been claiming that, for instance, it's something really is it's something that is really becoming a bit difficult for me to understand. Because on the other hand, the government claims that donors have not been able to supply them with enough vaccines. But on the other part, the same government claims that people have not been able to. In some areas, people have been reluctant to access the vaccine due to myths that it causes some health problems. So I think I would, if this is the case, I would think that maybe this is the area that government was supposed to focus on. If it is something about civic education, I think the best thing was to engage people like Maziko Matemba himself in the fight against the cholera, because he's a public health advocate, and I feel he's in the right position to advise government on the efforts that it's supposed to do to counter the beliefs by people against the cholera vaccine. Yeah. So maybe that's what I would say on that.
Very well. I'd come back to you, Maziko. Maziko, Henry made a point about behavioral changes. I'm wondering why people are waiting for the government to make changes to their lives. But again, this is something that we have spoken about before. The fact that cholera is not new to Malawi, and so people already know what cholera is like and how it could affect them. As a health advocate, why do you think people continue to behave the way they do despite being fully aware, at least as far as we are concerned, that this could be a very devastating infection?
In fact, that is what is shocking, because cholera in Malawi, according to statistics, Malawi identified, or it has been seen cholera since 1973. It's almost close to 50 years now, and in the last 50 years, it means Malawi have lived that we have seen cholera, even though the cases maybe were not as high as we are seeing now. That in the last 20 years, this is the worst in terms of the cholera spread in Malawi, that whether in season or rainy season and also in dry season, you find that the cases are still increasing. So having said that, the question is also, as you are aware, that our resources towards prevention of different kinds of diseases is not well supported. Because if you don't support prevention of diseases in terms of resources, like at the moment now, how much resources has been put in place to engage people so that people can be able to understand and think the need of preventing themselves. Because there's a lot to be done. Because maybe human behavior has changed over time. Even at the moment, the public which is at the moment and the public which was there before, you will find that the behavior has changed. because we're living with totally different people or maybe who have never lived with cholera as it has been previously. So you also need to find out why people are still behaving that as if there's no cholera, as Helen has mentioned, and how are we not maybe reactivate our systems, more especially the communal systems, which is supposed to go around and be able to support the sector. But looking where I'm standing, what I've just observed, the resources to cholera is very, very minimal. As I said, that government is challenged maybe to do much because the resources which is there to do, for example, prevention messages, by now would have seen that maybe some of the things which people are still doing would have stopped. So those could be some of the things which we believe the government can do more. For example, we have the media. I don't know how many media houses have been sponsored or given resources, even including civil society and other groups, even chiefs and other groups. Because once we start enacting those groups and be able to remind each other.
Yeah, but Maziko, the last time we spoke, the head of the task force says that they had a plan for education, which included going into the high-risk areas, the villages and the towns, and educates the people on the disease. Is that happening?
For example, what we have seen that in terms of treatment sites, you find that, yes, we have seen tents being constructed, additional space for cholera patients. That is on the treatment side. In terms of engaging other stakeholders, we have seen parliamentarians being engaged. We are yet more to see other groups, like as I mentioned, chiefs, civil society, and other opinion leaders, faith groups. Those also are critical, because if they are not involved, then they will be just watching. For example, if with the areas which I went, and I was asking myself to say, we need to do more, because things are not working here in Malawi if you don't manage the cholera outbreak, which is at the moment. It means it can also affect other programs which are still running, because this is a current threat which is happening at the moment. So for me, I think the government need to do more, and the country need to do more in sustaining the public, and also more especially, I've mentioned that issues of more research is critical, because if your research doesn't identify a problem, or researchers haven't identified where it's spreading, because we need to know where is the host, where is it coming from? Is it spreading through, like what has mentioned, is it spread through maybe food more? Is it spread through human movement? Those things, if they are found, you can be able to kill the host. Once you kill the host, then you'll be able to know the pattern. Because you need to understand the pattern at the moment. Where is the pattern? Is the pattern come from this side? For example, there's a case in Palombe, one of the districts in Malawi. The district health office officials in that district made mention that cholera started in their communities because one of the church group went to another district for preaching. When they were coming back, that's when they identified one case.
Very well.
It shows that the human behavior in terms of movement can also contribute towards the spread from one area to another. Issues of migration amongst through
and I would want us to continue on that point of movement. Maziko, I would want us to continue on that point of movement when we come back. Stay with us here. Don't go away. Welcome back to the Square. Today on the program, our focus is on Malawi, where more than 1,000 people have died of cholera outbreak in that country. So far, the country has recorded over 31 cases of the disease there. Many problems coming up. They do not have the vaccines. As of now, it's unclear if they have the resources. But our people here at the Square today have been talking about other ways that the government could help people go around the disease. And with me are Maziko, Hisbon, Matemba, who's joining us from Blantyre-Malawi. We also have Henry Kijimwana Mhango, who is also a journalist in the same country. Gentlemen, thank you so much for your patience. Let's continue the conversation with Henry. Henry, the task force at our last conversation did say that they were providing water tanks to give people clean and potable water in the areas that didn't have access to those. What would you say the situation has been? Has it been sustained? Did it even happen at all?
So I'll say that I have seen I've seen this happening in some locations, especially in Lilongwe City, but it hasn't sustained. Like I've seen that I've seen some areas that have been running out of water for some time, and people really struggling to access water. They have to move from this area to another area to access water. And again, this is only happening in the urban areas. It's not happening in rural areas. Yet, the places where, the places that are badly hit by water problem, I would say they are rural areas because they don't have access to potable water. They use boreholes. There are some areas that until today, people are drinking water from rivers and wells. So I would say that as Maziko talked about the need for research on this, I feel like this is one of the areas that government would have focused on if it was to prevent such kind of cases in the near future. Government needs to invest a lot in the water sanitation. If it does like that, that's really great. You find that until today, several houses, you find that maybe 7 or in the sometimes you find that 5 families are using one latrine. You can imagine that situation. They're using one bathroom. How to prevent cholera? In that way. So I think it's something that we really need to be serious as part of the government to prevent this. We need to work on issues of water sanitation seriously, and we need to look at it as a sustainable project. Secondly, I would also want to talk about economic issues. In fact, I would describe cholera as more an economic issue. For instance, you find that most of the people who contract the disease, are from low economic status communities, and these people have normally most of them are living below $50 a day, and again, you find that they can't even manage to buy a packet of sugar or bread. So what they'll do, they'll wake up from their homes with empty stomachs, and they go to the market with something little, with a coin, which would only manage them to buy maybe a piece of half-cooked food. And they would go, so they feel like they would rather buy that and take maybe a cup of water than staying for the whole day without eating. So the government would have focused much on empowering people economically. I'm sure in the next 5 to 10 years, will be totally addicted about the situation. This is the worst in the last 2 decades. This is the worst cholera outbreak in Malawi.
Right, and that makes sense in the long term. Thank you very much for that point. I come back to Maziko now. Maziko, we've seen the data, and it would seem that the government's loopholes in its own strategy shows a few things. One of the things that the health ministry has said is people who treat their deceased loved ones should be more careful. We know the traditions that come with that. But what I want to find out from you, Maziko, is if you were to go out on a limb right now, based on the data that the government is providing and its renewed measures towards curtailing the spread of cholera, what would you say government should be doing right now? Should they be shutting down for a bit?
Yes, I think looking at where we're coming from and also looking at how far we have gone with the disease over time until today, there are certain things which I think research, but also maybe I can say, which can also identify what we need to do. We need to curtail the current epidemic. One of the things is, as I mentioned, that how are other committees, which are also very important, supporting the current? Because peer education is also key, because people sometimes in the community respect each other. So if they see someone that think this is happening, which is not happening at the moment, as I said, that cholera is not only the duty of the health sector, it cut across other sectors. If you look at the sector of local government, which has a control of local councils, but also of a sector of water and sanitation. Those are also key sectors. How far are they doing in terms of making sure that the current water which people are taking is well protected? Or they are moving around in making sure that we have adequate chlorine administered the communities to be able. When I visited yesterday, I was asking if indeed the villagers, they have all those commodities in place so that they can be able to sanitize their sanitation facilities like toilets. They are also able to sanitize, or maybe I can say keep their water sources clean.
Yeah, but as you said, Maziko, the government is not providing the resources, or may not even have the resources to do some of these things in the short term. How can people help? How can advocates like you in the community help out?
Yes, for some of us, we are very ready even yesterday. That's why we were able to visit villages, communities, be able to appreciate what is going on at the moment, if some things have changed. Henry has mentioned, by now, certain things could have changed in terms of the behavior changes. So the other question could be, why are people's behavior not changing when they are living amidst, they have seen their loved one dying out of the disease? Because it's threatening. When I visited a facility last week, when I saw 2 people die whilst I was there at the facility with cholera, I was asking myself, how many other facilities if we can go, which is also happening the same way. But also, if you look at other commodities or supplies, which can also protect our health workers who are dealing with those conditions, is also another issue, because we also need to have facilities which can be able to support. Do they have gloves, masks? Do we have commodities, ORIS? Do we have chlorine? Do we have the water guard? All those chemicals which can kill cholera. But if they are not well stocked with those, it means that we keep on losing many people around us. So the question now is, we need to put resources in place. And also, as I said, we also need to do a research, because we cannot just put resources anywhere else. Maybe other areas that they need research. The research can tell you whether we need to invest more in treatment, or we need to put more resources into prevention. Because if we find that our treatment centers has 31,000 or 30,000 people being treated, it just shows that the area of prevention, there's not much resources.
Very well.
Or so there's not much effort.
So just so you address the question I asked, let's go directly as to whether the government should be thinking of shutting down certain areas or certain places, for instance, like schools, considering that it's very concerned about the number of children who are now dying.
Yes, I agree with you. I think places where I think people are staying, in terms of there's no proper sanitation, I think government should come in and be able to say, oh no, we cannot continue living like this, more especially in the high density areas, where you can find that there's a lot of people staying in those slums. Because in those slums, the water sources, people are building houses everywhere, and they're blocked even sanitation facilities, toilets. Others are even using water which is contaminated from the wells. I mean, this is the locality which they are living in those high density areas. I think there should be some action to make sure that those people who in those areas, they're able to be told that this area is not conducive for this.
Some action, indeed.
They can sometimes they use the police, the police or the armed forces to enforce.
Very well. I see. I'll just give Henry the last word on this one. Henry, the data shows that men make up 66% of the cases that are being seen. Now, talk to people out there as to how they can protect themselves from contracting the disease?
Thank you so much. So I would say that in the first place, everyone should understand that this disease is affecting, it's for him or her. It's not for someone else. If he contracts it, it's him who is going to be affected, it's the family. So I would love that regardless of the economic problems that we have, regardless of the challenges that we have, yeah, we have problems with access to safe water, but let's use the small resources that we have, let's utilize them to ensure that we are safe.
Very well.
For instance, if we, yeah,
Thank you, gentlemen, for Henry. I apologize, we would have to go. Thank you so much for your time here. Henry and Maziko joined us from Malawi, where cholera is ravaging some communities despite improvement in others. We'll keep an eye on the story. Clearly, the government has a lot more to do as far as long-term solutions are concerned. In fact, it should have done since cholera began affecting the country in the 1990s. Sadly, those long-term solutions are not in place. We hope this is a learning curve for Malawi, and we hope that the short-term solutions, which includes behavioral changes, are also put in place. People make changes, lifestyle changes. The water that they need is provided for them so that we can avoid these needless deaths. My name is Keminni Amanor. Thank you for your company here on The Square. I'll see you same time tomorrow. Bye-bye.